Hi there. Are you somebody who has hip pain, or maybe you just have hip discomfort that comes and goes, but you're looking for an exercise that you can do that'll give you a little bit of relief? Well, if so, friend, then this video is for you. Hi there, my name is Morgan Rysdon and I'm the creator of Center Studio, where I teach people skills to feel more comfortable more often. Now, if you haven't already, friend, make sure that you hit the subscribe button and that you also hit that notification bell. And that way, anytime I make a video like this, you'll be the first to know about it. So today's video is actually based on a video series that I did all on the hips. Okay, so this is number 3 of a 3-part video series. And I did it specifically because somebody emailed me. They said, look, my fiance is having some issues with her hips. She's got rheumatoid arthritis. And so I'm making these videos. And then my husband says to me, you know, Morgan, other people have problems with their hips too, not just people who have arthritis. And I said, oh yeah, that's true. That's a good point. So I just want to put that out there as a preface to this exercise, that you don't need to necessarily have arthritis in order to follow any of those other videos that precede this one. So I'll make sure to include a link below in case you haven't seen those, both video 1 and video 2, that you can check out as well. So anybody who has pain in their hips can definitely benefit from these. I just always like to get really specific, especially when somebody emails me and asks a question. I like to be very specific about it. So with that aside, I wanted to let you know that you can do this exercise either lying down or you could do it seated. So it doesn't really matter. For our purposes today, I am going to show it to you in upright, sitting in a chair. But if you're somebody who can get on the floor comfortably, give it a try. I find that this can be really nice because when you are allowing yourself to lie down in horizontal, you're letting gravity help you with this exercise. So it can be really nice, and it can also offer you some benefits that maybe you might not find when you're doing it seated. So play around with it. And of course, I encourage you, while I'm doing it today, that you do it along with me, right? That you sit there and you follow along at your pace, and then you can always re-watch it later and try it again on your own. Okay, so pay attention to the words that I'm saying. Pay attention to the thoughts that I'm suggesting you have when you do this exercise. It's actually based on Feldenkrais. It's like a Feldenkrais exercise. However, I'm looking at it through the lens of Alexander technique. So we always approach all things that we're doing with the idea of how am I doing it that matters. Not the what I'm doing, but how am I doing it, right? So how am I lifting up my leg, or how am I moving my arm? So I really want you to pay attention to the words that I'm suggesting you think about as we do this exercise. Okay, so to get started, I'm gonna move back here into the chair that I've pulled up. And to begin with, you always wanna sit on your sit bones. So if you don't know where those are, you want to put your hands underneath your bottom, and some of us have more padding or less than others, but they're basically these 2 bones that you sit on, like the name suggests. So go ahead and do a little digging if you must to find those, and then I always like to just kind of rock back and forth to be like, did I find them? Yes. And the reason for that, friends, is that when you're on your sitting bones, your spine is elongating, right? If I'm someplace on my lower back, in my lumbar, chances are I'm doing a curly something like this into a slouch position, and now I'm no longer set up for success doing the exercise. So the important thing is to always start from a really good place where you're nice and long in your spine, and then your feet are going to be flat on the floor. Okay, and we're going to pick up the foot at the toes. And now, if already you're like, I can't do that, Morgan, I'm not that flexible. Don't worry, friend. You can take a hand towel, you can take an exercise band, and you can just put it on the bottom of your foot, and then you'll hold on to that while we do the movement, okay? So instead of touching it with your fingers, you can always loop something around the bottom of the sole of your foot, and you can use that to facilitate, okay? And the important thing is that we continue to stay long. So even though I pick up my foot, I'm not gonna compress down here. I'm gonna stay nice and tall in my spine, okay? So again, my hands are here touching my toes, and try not to squeeze the heck out of them, okay? So the hand is nice and relaxed, the shoulders relaxed, and you're just gonna switch the knee like this, okay? So you're gonna unbend the knee, and then the hand and the foot come out. And pay attention to where my elbow is and my arm. So it starts on the inside of my body, and then as I kick my foot out with my hand, I move the arm to the outside. So I've switched sides, right? So one more time, this foot comes out, and then my hand comes inside with my elbow, and then again back and forth. And you'll do this a couple of times at your pace, however it's comfortable for you, and just to get a feel of how you're moving your foot in and out and how your knee can unbend, okay? From there, you're gonna take the foot out and in. So you simply just move your hand, and because your foot's in it, the hand and the foot go together, okay? So again, I'm not trying to move my hip per se, I'm thinking more about moving my foot and my hand. So if my hand goes out to the side, because my foot is in it, it's gonna go with it, okay? And then from here, after you've done that a few times, you'll flip it around so that your knee is towards the floor, okay? And I know it looked a little fancy, okay? Fancier than it really is. It's just that your knee now is down, pointed towards the floor. So that gravity here can help you. So this is something that you're probably less likely to do when you're lying down if you do this horizontal, but you can do this when we're seated, okay? So again, my hand has the toes in them, and I'll go back and forth, okay? So I'm moving my hand, which moves my foot, which moves my knee to move my hip, okay? And I'm just letting gravity do its thing. I don't worry about how far forward, how far back. I'm just letting gravity release all of those tendons, ligaments, all of the muscles of my thigh are just undoing themselves from that hip joint, okay? And again, if you're not as flexible, don't panic. You could put your foot here, and then you could kick the toes back, lift the toes up to go get it, okay? So there's always gonna be exceptions, and there's always gonna be modifications that you can make on your own. You might have to get a little creative about it, okay? So, and if that's the case, go for it, okay? So modify as you need, and then before you switch sides, friend, ask yourself, what feels different, okay? So we always like to think, has anything shifted? Do I observe anything that's changed? In my case, this leg feels a little bit longer and it feels a little bit more loose. The thigh definitely feels more relaxed and almost, I guess, wider is the way I think of it. And so I always like to just compare mentally for myself, has there been any change, okay, before I start the next side. Now let's say that you feel like every time you reach for your toes, you have to compress and then you have to get nice and long. You could always just cross your leg, right? You could just always bring your leg up and cross your legs, and now you're already halfway there, and now your hand meets your toe, okay? So always think about the how you're doing something, not just the what, okay? How am I going to reach for my hand? How am I going to wrap my fingers around my toe? Am I compressing, or am I staying long in my spine and just reaching my hand, okay? And again, if you are not that flexible, just get that hand towel so that you can move it with the hand towel in and out, okay? The exercise is equally as beneficial if you can't put your hands on your toes, okay, friend? So, and hopefully as you do it, you'll get a little bit more flexible, right? So you're gonna bring your hand again with your foot in and out. So it's almost like you're kicking your foot out and then you're bending your knee in. Kicking the foot out, and again, notice where my elbow is in relationship to my knee. So I'm going in and then I'm going out, okay? And we do this a couple of times. I'm going a little faster just because I want to make this video bite-sized for you. I don't want it to be too long, but you, of course, friend, can go at your own pace, okay? So then we're going to go inside and outside. So here, in this case, my elbow stays on the inside of my thigh and my knee, and I just move it back and forth, okay? So really quite simple. And then from here, we can swoop it around so that, again, my knee is pointing towards the floor and I've got my toes in my hand. So I like this here especially because I just feel like gravity helps, right? So I let gravity do its work. The knee is pointed towards the floor, and after a moment or two, then you can move your hand, which moves your foot and your knee and your hip. And you just kind of swing and open up that hip joint here, back and forth, forward and back, okay? So you're just gonna do this a couple of times where you're at, and then when you bring your foot back, see, has anything changed? Does it feel the same as that other side? Does it feel different? Is it something new? You know, the more you do it, ideally you're gonna notice some shifts and changes. Like maybe you get more flexible as you do it. Maybe you find that your range of motion is a little bit easier. So again, the idea is that anytime you have an exercise or you have anything that you're practicing, that you do it more than once and you give yourself room to play with it. right? To see like, oh, well, what if I sit in a different chair? Or what if I do it at a different time of day, right? Or what if I do it lying down? So I'm gonna encourage you to give this a try. Again, if you're comfortable getting on the floor, you could do it lying down on a yoga mat, or maybe you could even try it in your bed. Although I'd probably prefer a harder floor, to be honest with you. So preferably a yoga mat or something like that is gonna be most beneficial, because again, your spine is gonna have a lot more support when it's on a firmer surface, as opposed to like a bed, which sometimes our mattresses and stuff can be a little too squishy. So just give it a try. If you haven't already, friend, I'd love if you would subscribe. You can also like and comment. And of course, you can always share with your friends if you think that they would enjoy this as well. Okay, until next time, take care. Ciao.